Okay, we'll be discussing all about the spirochetes. Okay, so the spirochetes here are actually the spiral bacteria. So they may appear to be gram variable with a gram stain. They are highly flexus. They are helical. Okay, basically because their cell wall here is helical in shape, wherein it's being wrapped around their body with that special structure. You call that one as your eggshell filament or the endoflagella. Or other name for that is your periplasmic fibril, and that's served here as their organ of their locomotion. So they're highly motile because of that. Okay, so again, we have here the order Spirochetes divided here into the two family. We have your Leptospiraceae. That includes the genus Leptospira, which is causing here our leptospirosis. And we have also here the family Spirocataceae, Cetaceae, that include the genus Treponema, which is a sexually transmitted disease, try to cause here our syphilis. And we have also here the arthropod-borne, tick-borne transmitted infection caused here by our Borealia. Okay, so basically they are able to reproduce here by binary fission in the case of your Borealia and Leptospira. But in the case of your Treponema, that one's capable of your transverse fission. Okay, we discuss first your Leptospira. Okay, we have here the Leptospira interrogans, which is the causative agent of your leptospirosis, which is a human pathogen. And we have your Leptospira biflexa. Okay, we consider that one as our saprophytes. And we have also here the serovarity ectohemorrhagiae. Then we have your canicula and we have your australis. Okay, we have here the general characteristics of the Leptospira. So again, they are tightly coiled. So their spiral, they are close to one another that will able to form here just it would resemble here a chain of the cocci. Okay, they have one of their end or both of their ends may contain hooks, and they have two periplasmic flagella around their body. So they stain poorly with our gram stain, and the best way to stain them here for identification would be your silver impregnation with a silver stain, and identify that one through your dark field microscopy or phase contrast microscopy or even your fluorescent microscopy, but not our bright field microscopy. So unable to grow in artificial media, so not able to grow here with the ordinary agar media. So we have that one Flessers with a semi-solid. We have also your Erlinghausen, Macolone, Harris Johnson is also semi-solid. And we have also here the liquid and artificial media. We have your Flessers. We have here your Stewart, I mean. Okay, then we have here the manifestation of your leptospirosis. So basically, the bacteria can be found in the water, in the mud, and you get infected by that by skin penetration if you have an open wound or breaks in your skin or laceration. But recently, it was then identified that even if you have an intact mucous membrane, could still allows the infection to occur. Okay, incubation period for this one takes 10 to 12 days with an average of 3 to 30 days. So we start here with an influenza-like manifestation with a fever, with the chills, with the headaches. And later on, it try to have here manifestation of your hepatic, renal, and we have also here the CNS involvement. And because of the hepatic involvement for that one, so we're expecting that the patient to have a yellowish discoloration. Naninilaw ang patient natin. So our kidney problem would eventually be related to your, in the form of your interstitial nephritis with the swelling of the glomerulus here in hyperplasia, but does not affect glomerular swelling with and hyperplasia without, does not affect the glomerulus. Okay, so the most prominent physical finding related to this one is in the form of your conjunctival suffusion. And later on, the patient tried to develop here systemic disease characterized by the problem in the liver, hepatic, renal failure, and with intravascular hemolysis if left untreated that results here to the death of the patient. So the treatment, doxycycline, so if the patient has been exposed, doxycycline could also be a prophylaxis. It could also help here like to prevent, like if you come in contact with the water, then you can take this one. So it could help. Mura lang naman doxycycline. Okay, specimen collection, the best specimen to collect here during the first week of infection would be the blood and even the CSF. On the second week, then you can have your urine as your sample for diagnosis of the infection. Okay, the systemic disease, anyway, you call it once your wild disease. This one. On the next one, we have here your Borealia. So we have Borealia recurrentis and we have also here the Borealia border fairy. Okay, so this primarily the group of Spirochetes these are transmitted here by arthropod or a vector-borne type of the infection. So Borrelia considered here to be less tightly coiled compared with your Leptospira. There are only 3 to 10 spiral, okay, in each of the cell, and it contains there approximately 15 to 20 periplasmic flagella wrapping around the body of the bacteria. Okay, this one stain effectively readily with your Gemsa stain. So you could have your blood as your sample for this because like in the case of your relapsing fever, so of the fever and patient natin, then you collect your blood sample during the time where the patient is on the febrile stage. And you can stain the blood, smear, and then eventually help you identify this bacteria. So because this one is stained readily with our stain, GEMS or gram stain, then eventually can be identified by your bright field microscopy. On the first species of your Borrelia, we have Borrelia recurrentis. So this is a causative agent of your recurrent or relapsing fever. Okay, so there are two modes of transmission here. We have your endemic relapsing fever transmitted primarily by the bite of your tick belonging to your genus or Nitodorus. So the bacteria is in the saliva of your tick or Nitodorus. On the other hand, we have also here the epidemic relapsing fever is transmitted here by your lice, louse, pediculus humanus. You can be infected by that one if the lice has been crushed, okay, and scratched in your skin, and that would allow the bacteria to penetrate your skin. Okay, relapsing fever is characterized here by a type of fever which try to relapse or recur every now and then. Incubation period for that is 2 to 15 days. To start with high fever, the patient would have here myalgia, rigor, severe headache, muscle pain. Then after 3 to 7 days would be the entire febrile stage. And after that one, it try to subsides. And then you develop here an immune response. But then again, after a week, it try to recur. So that's why it's being called here as our recurrent fever or your relapsing fever. Okay, then we have here the pathology for the relapsing recurrent fever. So why the fever keeps on recurring here? Number one, because of the suppression of the complement activity of the host immune system. It try to produce here the inhibitor of the complement. So it try to inhibit activity of the complement. So try to activate here the production of your C4b binding protein, another one is your factor H, which try to inhibit our complement. Remember that your complement, it try to protect our body against your pathogen. So if you have the inhibitors, your complement will not be activated. Another one is mechanism here why it try to recur because of your production of your antigenic variation. So basically, the bacteria try to change its antigen that will enable the host immune system here not to recognize. So paiba-iba siya ng antigen and that will eventually be difficult for the host here to identify that one is the pathogen or not. Okay, the drug of choice for that, we have here your tetracycline. Another manifestation for some patients on which they are given an antimicrobial drugs here, they try to develop your fever, headache, malaise, and that's because of the bacteria try to release endotoxin as a response to your antimicrobial agent. And they call the reaction here as your Gerisch-Hersheimer reaction. The next one, species of your Borrelia, we have your Borrelia borderferi, causative agent of your Lyme disease. This one is also transmitted here by the tick, by the bite of the tick belonging to your Exodus na genus. So we have here the 3 stages of your Lyme disease. The first one, stage 1, is characterized by a localized skin manifestation. You call it one as your erythema chronicum migrans. wherein at the site of the bite of the ticks, it try to develop here a red macule, and that macule later on try to produce here erythematous ring with a central clearing. So clear ang center niya that would appears to be like it would resemble here a target. That's why you call it once your erythema chronicum migrans. With the stage 2, on the other hand, you call this one as your early dissemination phase where the bacteria try to spread to other part of your body. So that one would be characterized by the development of your secondary skin lesion. It would have also migratory pain involving your joints and your bones to your body. It also have alarming cardiovascular, neurological, and we have also here splenomegaly manifestation. The stage 3, we define this one as late manifestation or late dissemination phase. This is characterized here by the following. So still have your cardiac, musculoskeletal, and neurological manifestation. So musculoskeletal, later on, it would try to develop your arthritis. Okay, the next one, we discuss your treponema. So treponema, there are 4 to 14 okay, spiral in each of the organisms, and is made up of 3 or have your 3 periplasmic flagella surrounding the entire body of that. This one could be identified only by your dark field microscopy and would have your characteristic of flexus appearance in your liquid medium. Okay, then we have here your Treponema pallidum, subspecies pallidum. So this is the causative agent of our syphilis. So syphilis is a sexually transmitted disease. It tries to produce here your hard chancre. And that one is transmitted by sexual contact or even transmitted also by your transplacental or even your blood transfusion. So we have here the stages of our syphilis. The stage 1, primary stage, characterized here by the development of the lesion primarily on the genitals of the patient. So for the male, most likely that one could be found outside the penis. Or in the female, it's inside in the vagina or even an endocervix. And basically, you call that one here as the chancre. It's most like this one is hard chancre. So the lesion, we try to characterize this one as single erythematous lesion, which is non-tender, clean surface, but firm with a raised border. Secondary stage, on the other hand, characterized here by the development of your secondary rash, described as macular, papular, follicular, papulosquamous, postural, usually found in the palms of the hand or even the soles of the feet. Then before I try to enter the tertiary stage, it enter first here the latency period where the patients do not show signs and symptoms. So you have early latent stage here that's occur less than 1 year, and we have the late latency that might occur here after more than a year. Then you try to enter your tertiary stage with the following manifestation. The first one, gomatus, characterized by your granulomatous lesion, primarily found on the skin and the liver or even the bones of the patient. Then it would have also here the CNS involvement. You call this one your neurosyphilis with the cardiovascular involvement as well. Okay, we have here laboratory tests that will help us diagnose our syphilis, although this one will be discussed really on in our immunology serology. Okay, so but before that one, we have your congenital syphilis. So congenital syphilis is a type of infection acquired through your transplacental transfer. So the baby try to manifest that infection. Okay, for the test, we divide our test here as non-treponemal antibody testing. And we have also the treponemal. Non-treponemal antibody testing, you are detecting here for the non-treponemal antibody, which is non-specific antibody with your syphilis, with your treponema. I mean to say this one is also being this antibody or non-treponemal antibody calls one your reagent. Okay, the reagent here is not the same as your reagent IgE, which is your antibody. IgE, other name for the reagent, but this is not referring to your IgE. Actually, this antibody is IgM or IgG. Antibody is being produced here not only by your treponema, but also being produced also by other diseases. So, making this one as non-specific antibody. Since you are detecting for antibody, our agent for that is your antigen in the form of your cardiolipin. So positive result for that is identified through your flocculation. So it's a type of agglutination reaction. Okay, the test here, we try to utilize this principle. We have your RPR, Rapid Plasma Reagent, and your VDRL, Venereal Research, Disease Research Laboratories. Those are your non-treponemal tests. Your treponemal test, on the other hand, you are detecting treponema antibody, which is very specific for your treponema pallidum. And with that, you are detecting also here through your antigen or agent in the form of your treponemal antigen. Again, if you get positive for this one, it's really for your treponema pallidum. Kaya nga specific itong ating treponemal antibody testing. Example of that, we have here your fluorescent treponemal antibody absorption test, treponemal pallidum particle agglutination test, and you could also have your enzyme immunoassay. Most likely, pag non-treponema, that will give a positive results on the earlier stage, stage 1, stage 2. But in the late stage, mga stage 3, so ito, ang gagamitin natin dapat. Treponemal, mga treponemal tests. We have here either treponema, which are non-venereal or non-sexually transmitted. The first one, subspecies pertenue, triticoserios, which is your granulomatous nodules. We have also here the behel, subspecies endemicum. Okay, so that's your behel or endemic syphilis. And the subspecies Caratium triticosserpinta, which is having a skin lesion manifestation with the erythematous, erythema, redness, or even scaling of the skin. So this all with our Spirochetes. Thank you.